now where a flesh-eating bacteria has now killed a fifth person in the state just this year. The bacteria live in coastal waters and can infect people through open wounds or when a person eats raw or undercooked seafood. And with the number of cases and deaths higher than usual, health officials are warning residents to take precautions. Let's bring in CBS News reporter Katie Weiss, who's live for us in New Orleans. Katie, what do we know about this unusual rise in cases so far this year, and how are people really contracting this dangerous bacteria?
Sure, Liz. Good evening. It's really a serious problem here on the Gulf Coast, especially this year more than previous years. So far, the Louisiana Department of Public Health says that there have now been 26 documented cases just this summer here on the Louisiana Gulf Coast, and 5 people have died as a result of this Vibrio bacteria that is known as a flesh-eating bacteria. You can get it more often in the summer months by going into the water with an open wound or a cut, in especially water that may be contaminated with this bacteria. And it happens more often in the summer months because it's warmer and the water has a better, opportunity for the bacteria to grow and thrive. You can also, as you mentioned, you can get it by eating raw or undercooked seafood that might be contaminated by the Vibrio bacteria as well. While the majority of the cases here in Louisiana are a result of people going into contaminated water, still, we know that 2 people have actually died as a result of eating contaminated seafood. So definitely something to keep an eye out on. Now, people who are immunocompromised really are the most at risk. So if you're taking certain medications that can make you more immunocompromised, if you're undergoing certain treatments, if you have certain diseases like cancer, diabetes, HIV, things of that nature, those are things that you need to, be cognizant of, especially during these warmer summer months all the way through to October. Now, also in southern Alabama, so far there have been 10 documented cases, and in Mississippi, 3 documented cases. One man has even died there. Our affiliate here in New Orleans, WWL, was able to speak with the man's loved ones. Take a listen to what they had to say.
Along with having fun and fellowship, he also gave back a lot to the community. He was a good Christian and devoted a lot of his life to making our community and the coast a better place to live.
Certainly such a tragedy for all of those people who loved and knew that man. And it's so scary for anybody. I mean, here on the Gulf Coast, we love to go out and be in the water and boat. And so it's definitely concerning to hear that cases are much higher than normal. Again, on average, usually only about 13 cases a year. Liz?
And it's not just the Gulf Coast, Katie, that we're seeing this problem. What other communities have been impacted?
Absolutely. All the way from down south in Miami and the Keys, all up the eastern coast as far north as Massachusetts. Even some oyster beds have been closed as a result of Vibrio this year. So it's certainly an issue. Here's what an infectious disease doctor from LSU had to say about that.
And it's not just a Gulf coastal phenomenon any longer. Global warming is moving infections with Vibrio vulnificus up the East Coast. Cases are being reported in Connecticut, New York, much less in the Chesapeake Bay.
And some signs and symptoms that you might want to watch out for: watery diarrhea, stomach cramps, nausea, vomiting, and also look for redness and swelling, warmth on your skin if you've been in water that you think might have been contaminated. And again, if you're immunocompromised, be extra careful at least through October, because that's when Vibrio tends to be more prolific. Liz?
Katie Weiss.
There is deadly disease in white-tailed deer in Pennsylvania. It's called epizootic hemorrhagic disease, or EHD. It is spread to deer when they're bitten by infected tiny flies people call no-see-ums. The virus has been detected in Erie, Butler, Lawrence, and Mercer counties. Test results are pending in southwestern and southeastern Pennsylvania. EHD is often, but not always, deadly.
It's a bit unpredictable, and that's one of the reasons that we ask the public to help out and to report dead deer to us when there are multiple deer found in the same spot. Deer that are infected with EHD often do die near water. So
Deer usually show signs of sickness about a week after infection, then die relatively quickly. Visible things to look out for include swelling of the face or neck in the deer and excess saliva. This is not transmittable to humans.
The Michigan Department of Natural Resources confirming tonight the year's first case of epizootic hemorrhagic disease. Cases have now been found in white-tailed deer in the wild in 4 counties: Eaton, Jackson, Van Buren, and Washtenaw. EHD is a viral disease known to affect white-tailed deer. The DNR says deer can't transmit the disease to others, and there's no evidence that humans, pets, or other Michigan wildlife can contract it. If you suspect the deer has contracted or died from EHD, the DNR does encourage you to submit a report through the agency's Eyes in the Field system. The DNR says cases of EHD typically pop up late in the summer and early fall.
In your health news, you may be hearing this term more. It's called nightmare bacteria, and doctors say cases have shot up across the country. A CDC study now showing that there has been an increase in those infections. DC News Now's Liberty Simmons talks with the author of that study and tells us what to watch out for.
Super scary. I hope they can get a wrap around it.
The CDC is warning cases of a superbug known as NDM-CRE have increased 460% from 2019 to 2023. Most cases found in healthcare settings.
This increase that we're seeing in NDM-CRE cause us, some alarming concern because these bacteria can cause infections that are extremely hard to treat.
Dr. Danielle Rankin was one of the authors of the CDC study. She says the bacteria is difficult to treat because it is resistant to antibiotics.
I'm very worried about it. Sure. I think that older people need to be worried. I think that children need to be worried.
The study found NDM-CRE cases rose by 456% in Maryland and by 359% in Virginia. Alex Bacos says he's worried about his elderly mother.
I have my 90-year-old mother right there with me. We just took her to the doctor. We try to keep her as clean as possible. Again, it's very simple. Just wash your hands.
Dr. Rankin says the cause of the increase is under investigation, but the spike in cases is being seen in healthcare facilities. Because of that, she stresses the importance of healthcare providers practicing good hygiene.
What we are concerned about is the ability for these to be able to spread outside of healthcare if we aren't able to halt transmission.
And that was Liberty Simmons reporting there. Well, Dr. Rankin says it is important for doctors to test patients specifically for that bacteria. She also says there are antibiotics available for patients through IV.
Well, the potentially deadly Chagas disease is spreading across the U.S. and in the South in particular. Chagas disease, which is spread by kissing bugs, has been declared an endemic by the CDC. It's popping up all over the South. But as Maya Caleb explains, Alabamians may be in the clear for now.
There are kissing bugs in Alabama, but as of this year, no cases have been reported. So as of now, Alabamians are safe. This hasn't always been the reality. The last case was reported in 2019. A kissing bug leaves behind parasites when it bites an animal or human, and that leads to Chagas disease. The concern, however, isn't with the immediate impact, but the long-term one.
Once you have Chagas disease, it'd be symptoms like a headache, fever, maybe swelling at the bite site. And then it's basically dormant for a period of years. It can be dormant for 10 to 18 years. And then when it kind of wakes back up in your body, it can cause a lot of heart-related issues.
Most cases come from kissing bugs in places like Central or South America. So people will travel, get bitten, then return home with Chagas disease. Fast action is the key if you've been bitten.
If you do get a bite and you do notice symptoms, you can confirm, or you can go to the doctor, and the doctors can confirm if the parasite's in you with several blood tests. And I believe once it's been identified in your body, it's really not that hard to get rid of it as long as you treat it early.
Kissing bugs are named that because of their tendency to bite people on their faces. If you suspect that you've been bitten by a kissing bug, the entomology department with the Alabama Department of Public Health wants to hear from you. You can email them and they'll either come and pick up the bug or you can mail it to them so they can observe it. In Birmingham, Maya Caleb, WVTM 13.
The Department of Public Health is investigating several active cases of measles in the upstate.
The outbreak, we're told, is being sourced from communities with low rates of immunization.
Our Caitlin Ashbaugh is live after speaking with health experts. And Caitlin, what can you tell us?
Mark, City, the Department of Public Health tells us that every case they're looking into involves a patient who was either unvaccinated or someone who did not have the natural immunity rates from a previous exposure to measles. We're also told that many of these cases are still under an active investigation.
It's rare to see measles cases. I have not participated or been in an area with a measles outbreak in my career, and I've been practicing since 1993.
8 cases of the measles have been reported in the upstate since July, a highly contagious disease, starting with symptoms of a common cold like fever, cough, runny nose, red eyes, developing into a red rash on the skin. 95% of those exposed without immunity will develop an infection.
There is a high risk for continued rapid spread of the disease, especially in the upstate.
The department was unable to tell us exact locations for exposure, but 2 of these come from unidentifiable community sources. 5 are being traced back to an undisclosed school, which is still open. Exposed or diagnosed children are expected to quarantine.
Anyone can experience complications unpredictably, and that's the reason why we encourage everyone to get protected from unexpected exposure and unexpected complications.
Vaccination rates are down in South Carolina, about 90%. This includes higher exemptions for school children. Bell says one person could spread the virus to between 8 and 20 people with areas of low coverage. She adds 2 doses of the measles vaccine can provide a lifelong protection rate of 97%. Those who have already been exposed can still be vaccinated between 72 hours after close contact.
We're seeing these things make a comeback that we rarely saw in the country before. So it's important to be careful and take care of yourself.
Medical professionals and doctors' offices in our area, they're asking people to make them aware in advance if they think they might have been exposed or might have been diagnosed with the measles so that when they receive care, they can do so in quarantine. They're also saying that if you're someone who's immunocompromised, pregnant, or if you're around young children, you should take extra precautions at this time to make sure that you're helping to prevent the spread of this disease. Reporting in Greenville, Caitlin Ashbaugh, WYFF News 4.
Linked to pasta products sold at Trader Joe's and Walmart has left at least 4 people dead and over a dozen people sick.
This is so awful. It's like, what can you eat these days? The affected items include Trader Joe's Cajun-style blackened chicken breast fettuccine Alfredo and Walmart's market-side linguine with beef meatballs and marinara sauce. Customers should throw out or return these products immediately.
To add to that, nearly 60 million pounds of corn dogs and sausage on a stick products are being recalled due to possible pieces of wood in the batter. The recall includes State Fair corn dogs and Jimmy Dean pancakes and sausage on a stick made by Hillshire Brands. There have been complaints, including 5 injuries linked to the issue. The products were sold nationwide and distributed to some schools as well.
Delta Airlines says it will open up seasonal daily nonstop flights from New York's JFK International Airport to Portugal. The flights will begin May of next year and run through October of 2026. Delta says it expects the Porto region of Portugal to grow by about 20% this year alone.
The Consumer Price Index says coffee prices are up almost 21% from just a year ago. Industry experts say the price hike is due in part to both global production issues and higher prices because of tariffs. Prices have been ticking up by about 3.5% every single month. Coffee prices have seen their highest annual jump since 2011.
Target creates a new aid for the visually impaired shopping in its stores to help speed them through checkout. Target says it's developed a first-of-its-kind self-checkout stations for people with visual and other motor impairments. The new checkout options have features that include Braille and high-contrast button icons. Target says the new stations will start rolling out nationwide for use during this upcoming holiday season and continue through early 2026.
It may cost some Snapchat users a little cash to hold on to their fondest memories. it will be imposing a storage limit on its Memories feature. The Memories feature debuted in 2016, allows people the chance to save a photo or a video taken in the app without it disappearing in the requisite 24 hours. People who store more than 5 gigs of Snapchat memories will now be able to purchase memory storage plans.